If you notice any of these 7 signs, you might be just a few days away from a heart attack, and you should look for a cardiologist as soon as possible. Because with every passing moment, a part of your heart is being lost. Saying I was surprised would be an understatement. I was honestly scared. Unfortunately, in the past 10 years, heart attacks have been steadily increasing, and every day they're happening more often, in particular among people under 40 and women. I'm Mohammed Zareh, a good doctor, and I want us to discuss together why the rate of heart attacks is rising and why it's happening more among young people, both men and women, and even those who previously seemed to have no heart problems. And it happens just when you least expect it. Today I want to reveal this secret to you, but I also want to hear your opinion. Look, according to international authorities, cardiovascular diseases claim the lives of more than 17 million people every year. That means more than 30 people die every minute. Even cancer and car accidents don't cause as many deaths. The problem is that these diseases are silent and hidden. By the time we realize it, it's already too late. And the reason is that people aren't told about the 7 warning signs that can appear in the body before a stroke, sometimes a month before, sometimes just a few days before. Today I want to teach you how to recognize them. A lot of people tell me about silent heart attacks or pre-stroke symptoms. At the end of the video, I'll also tell you what's causing strokes in people under 40. So why do strokes even happen? The heart pumps blood, which contains nutrients and oxygen, to the entire body, including the heart muscle itself. The coronary arteries are those vessels located on the wall of the heart, and their job is to supply blood to the heart itself. A heart attack, also known as coronary syndrome, happens when the blood flow in these arteries gets blocked. This can be due to the clogging of the arteries with cholesterol, calcium, and inflammation in the artery walls, which prevents blood from flowing freely. The main cause of this issue is atherosclerosis, or hardening of the arteries. The problem is that atherosclerosis is a silent threat, like cholesterol plaque and inflammation that grow inside your arteries and block blood flow, and it does this very gradually. It takes years for the blockage to become complete and cause a stroke or sudden death. But in some cases, even before the artery is completely blocked, the plaque can rupture because it has become very soft due to inflammation. When it ruptures, a blood clot forms on it, which eventually blocks the entire artery and causes a stroke. Now, before this happens, you might experience symptoms or warning signs known as pre-stroke indicators. A pre-stroke is a condition where the shortage of blood and oxygen to your heart hasn't been severe enough to cause the death of part of the heart. But this could happen in the coming days. When do these symptoms appear? They might occur when you're stressed, scared, arguing, during intense exercise, when you haven't slept enough or have poor sleep, or in any situation that significantly raises your heart rate. But it can also happen at any time of the day. And remember, a pre-stroke doesn't always have obvious symptoms. It doesn't always mean chest pain. There are some discomforts you might feel and think there's something else. So the first thing I want from you is this. Don't ignore the things I'm about to tell you. Your health depends on it. Let's look at the 7 warning signs that occur before a stroke. The first one, which is very common in women and the elderly, it's digestive discomfort. Stomach pain that seems like gastritis but actually isn't. Bloating, stomach pain while eating or afterwards, or even pain when walking or being active should make you consider whether it might be coming from your heart, especially if you have risk factors. That means your family has dealt with this issue. There's a history of stroke in your family, or for example, you smoke or consume alcohol. The main risk factors for stroke are the same ones that cause blocked arteries. Being over 50 years old. Of course, it can happen at any age. Diabetes, high blood pressure, obesity, or excessive abdominal fat. Smoking, or if someone in your house smokes, it doesn't make a difference. You become a secondhand smoker. In my experience, when I visit patients who have had a stroke, they tell me the symptoms started a few days earlier, like a burning sensation or pressure in the stomach. And because they thought it was gastritis, they took antacid or omeprazole pills, but it didn't help. So take this very seriously, because if you diagnose it in time, you can save your heart. Pay attention to the second symptom. 70% of women who had a heart attack said that in the days or sometimes hours before, they felt extreme fatigue or shortness of breath. It's similar to having a cold but without a cough, fever, or sore throat. This should catch your attention. It's a kind of severe weakness or muscle fatigue. So if in the past 3 days you've started to feel shortness of breath while walking down a street, going upstairs, or a fatigue that doesn't match the amount of activity you've done, you should consider that maybe your arteries are blocked. even if your chest doesn't hurt. Now, how can we tell if shortness of breath and fatigue are really from the heart and not due to inactivity, anemia, bronchitis, or lung problems? Well, you should suspect a pre-heart attack or a silent heart attack in two situations. First, if you notice that this symptom has gotten worse over the past days or weeks and you didn't have it before, you should be suspicious. And second, and more importantly, when you have those risk factors and you also experience the other symptoms I'm about to mention, your suspicion should be even stronger. The third symptom is jaw pain. Be careful here. Just like when your leg tingles, the problem might be from your back, or when your shoulder hurts, the issue could be from your gallbladder or liver. When your jaw hurts, especially the left side, it could be a problem with your heart and there might be a risk of a heart attack. This happens because when we are developing in our mother's womb, our organs pull nerves from other parts of the body along with them. That's why when we grow up, the brain gets confused about where exactly the pain is coming from. For example, your heart is suffering, but the brain thinks the problem is in your jaw. It's hard to explain scientifically. If you understood, leave me a comment saying you got it. What's my message? If your jaw pain started a few days ago, especially if it's accompanied by severe malaise and you don't have any dental issues that could explain it, go see a cardiologist immediately, especially if you have other symptoms as well. Number 4, cold sweat and paleness. Don't ignore this. Up to 30% of people who had a heart attack experienced this feeling in the days before. You suddenly start sweating for no reason, but this sweat is different from the sweat you get from heat or exercise. It's a cold, sticky sweat along with a feeling of chill on your forehead or all over your body and a sudden paleness of the skin. It might get better on its own after a few minutes. It's like it comes and goes. This can happen while you're resting, eating, or at any moment, and usually repeats several times before the main attack occurs. Number 5, back pain. Back pain? Pay attention here because I've seen many cases during my medical practice. Pain in the shoulder blade area, scapula, or lower neck, especially on the left side, can be a sign of the onset of a heart attack or a problem with the aorta. Many people think this pain is muscular, but what should catch your attention is that this pain doesn't get better or worse with massage or by changing your body position. The aorta is one of our largest blood vessels, carrying blood to almost the entire body. Sometimes certain diseases can weaken its wall, causing ulcers or tears that result in very severe pain between the shoulder blades. The pain is extremely intense. It feels as if something is piercing you from the front of your chest all the way to your back, but when it comes to the threat of a heart attack, back pain is milder. It's more like a pressure. It usually doesn't last more than a few minutes and comes and goes. We should suspect the heart, especially if you've never had this symptom before. If you can't find any other reason for it and it's accompanied by shortness of breath, severe malaise, or other symptoms. Number 6, numbness in the left hand and arm. Have you noticed in the past month that your left arm and hand have a mild pain or a feeling of numbness that comes on when you walk or go upstairs? This could be a warning sign. Of course, this could have other causes as well. But if this symptom is new in your life, you have risk factors and you can't find a logical explanation for it, go see a cardiologist. And number 7, watch out for those sudden dizzy spells, feelings of faintness, or drops in blood pressure that come and go for no reason. Or if it happens recently during physical activities like walking upstairs or even while eating. Many of these patients, when they undergo angiography, that's the imaging with contrast dye of the heart's vessels, we see that the blockage is almost complete. So how can we tell if what we experienced was a warning sign before a heart attack or the heart attack itself? When a heart attack happens, it means that a part of the heart muscle has died because it didn't get enough blood. Most people feel a pressure on their chest that lasts for several minutes and doesn't go away. In addition, it may be accompanied by nausea, vomiting, a general feeling of being unwell, shortness of breath, or any of the symptoms I mentioned earlier, even a sense of impending doom and cold sweats. And the difference with a pre-heart attack isn't in the symptoms themselves. It's in the duration. Generally, a pre-heart attack, or what's called a threatened heart attack, which are basically the same thing, doesn't last more than a few minutes, up to 15 minutes. And when you calm down, sit down, or take a nitroglycerin tablet under your tongue, it gets better quickly. So if you have these symptoms, it could be an early warning that your arteries are blocked, but at the same time, it's a sign of hope that there's still a lot you can do to save your heart, and you still have time. So get help as quickly as possible, go to the emergency room, call an ambulance, or tell a family member, because with every passing moment, more of your heart is lost. The first hour after the onset of symptoms is the most important time for us. It's called the golden hour, golden time. because the actions taken in the first 60 minutes are crucial for saving the heart muscle, and also because most deaths from cardiac arrest occur within this first hour. Now, is there any difference between you and me in the symptoms of a heart attack? Generally, no, but women and older people are more prone to silent heart attacks. That means without chest pain. It's very common for this group to feel symptoms in other parts of the body, like the stomach, back, or with nausea and vomiting. But this can also happen to men and at any age, especially if you have the risk factors. If you have diabetes, you might not feel any severe pain at all to even suspect it's heart related. Now I want to open up a new topic. What has caused the increase in heart attacks among young people and women? In the past 15 years, officials have reported that hospitalizations due to heart attacks in people aged 39 and under have increased by 60%, and the rise among women is also significant. Mortality has also increased by 10%. The reason is that the factors causing atherosclerosis or artery blockage have become more common among young people. Has modern life really made things easier, or do we just think so? Fast food is just a click away at your doorstep. TV series are available to watch anytime, anywhere, but at the same time, every year we're becoming more stressed. We sleep less because of electronic stimuli and worries. On top of that, food is becoming less and less natural every day. Ultra-processed foods have arrived. Vegetable oils with terrifying amounts of omega-6. All of this inflames us from the inside. It leads to fatty liver, cholesterol buildup, calcium deposits, and inflammation in the arteries, causing plaques in our vessels to rupture and resulting in strokes and heart arrhythmias. So one of the biggest culprits is our modern lifestyle. Now I'd like to hear your opinions and experiences as well. Do you know anyone who had these symptoms before a stroke? Your experience can serve as a general guide for everyone watching this video. I hope this video has been useful for you. Share this video with others. Give it a like. Leave a comment so the video can reach more people. Follow my channel and watch these videos as well for more information. Until the next video, take care.